Hello everyone, this is Chadi Alraies from SIF 2023. I'm today privileged to be with Dr. Tony Nassar. He is interventionist from Indiana. Tony, thanks for being with us.
Thank you for having me.
So we were talking offline before we went on live about life after training and real life after training. How's it like in terms of private practice? So give the audience, especially the fellows coming up now, a glimpse of what's expected.
Yeah, I'm in private practice. I'm in a town of about 55,000 people. In the county, it's about 100,000, and within 60 miles is about 1 million patients live in my area. About an hour and a half west of Indianapolis, 2.5 hours east of St. Louis, 3.5 hours south of Chicago, and 2.5 hours north of Louisville. So not near a major city, not near a major quaternary center other than Indianapolis.
Yeah.
But we have 2 tertiary care hospitals in our town. I have a private group. We have a private office. We do outpatient cath with an outpatient office-based cath lab. No interventions done in the office at this time. We do diagnostics and cardiac caths in our office. We have a very large population. In our town, we do not have endovascular surgeons. We don't have interventional vascular radiologists, so we have to do it all. We do all the the diagnostic, as well as the procedural angiography and even interventions from peripheral. I don't personally, but my group, we do it all. We do pacemakers, ICDs, but no ablations. We do not do transplant, but we do everything else. We do structural heart with left atrial appendage closure. We do robust TAVR program. Of course, the bread and butter life after fellowship is in the coronary space and heart failure space and imaging and non-invasive testing.
Right. So how is, for somebody graduating now, how he or she can be prepared for a setup like this? Where hit the ground running, busy.
I would pick an area beyond the heart that you're interested in, such as peripheral, such as structural, such as electrics. And be prepared to do at least more than one thing well. Trying to be jack of all trades and master of none, I would argue against that. But I would get your training done if you're interested and passionate about peripheral arterial disease and endovenous space. Get that peripheral training done while you're in fellowship before you go into practice. Same with the structural, same with the pacemakers and/or TEE with advanced imaging and coronary CTA and cardiac MR. Get it done before. Once you go into practice, there's not a lot of time to master it and come out and hit the ground running to really build your practice.
You mentioned something about venous, deep vein. So this is, I see it up and coming. There's a lot of people acquiring on the job. So what's your perspective on that?
Sure.
Space?
Organizing a PERT team at a community hospital like ours can be quite difficult, especially when you're limited on personnel and subspecialists to corroborate. So you really have, if you're interested in the endovenous space, catheter-based thrombolysis and peripheral interventions within the endovenous space, get your training done early with the procedural indications and techniques rather than try to learn it on the fly when you go out into practice.
Yeah. Some setup about, people talk about outpatient setup for venous ablations is it something that our fellows, for example, ask us, is it something we should acquire or not? I'm not sure. I have mixed feelings about it, but how is it in private practice?
Sure, in private practice, that's something our group does. Of my 7 partners, 2 do it very well. So we all feed the volume of the endovenous ablation to those catheter-based endovenous ablations to those 2 out of 7 partners. They do it very well. It's something that we need to offer in our town, and you have to be passionate about this because these can be quite difficult and challenging from a technical standpoint. And more importantly, I think for anybody coming in practice is who not to perform a procedure in, as well as to who perform the procedure in.
Absolutely. Well, Tony, thanks so much for a great overview of what to expect after training. Watch these videos and others on SIF YouTube channel. This is Chadi Alraies from Chadi. Tony, thanks so much.